But so now I'm going to shift over, and I know I'm rambling, but I'm going to shift over into Medicaid or Medi-Cal. So Medicaid is, it's a public health insurance program that, provides health and care for low-income individuals, families with children, seniors, disabilities, pregnant women. It covers more people than Medicare. Medicare, very narrow coverage or eligibility. Medi-Cal's eligibility is a little bit more broadened, but the income level. So here, this is from our current, I don't know, I'm sorry, it's tiny. I'm going to zoom in a little bit. So this is the income limits that you have to qualify for full Medi-Cal, right? So a family, one person, you cannot make any more than 138% of the poverty level, which is $17,000. And then it goes on and so forth, right? Well, guess what? $17,000 is nothing. That's Skid Row. To me, all of this is, for California, not even compatible with housing and life. So one thing I ask is that if I can't get single payer right now, like right now, can we at least raise this income limit? Because even the middle class is struggling. And if you make $50,000 or $60,000 as a family of three living in California, you're still struggling to survive. That's barely putting food on the table. And so if we could raise these income limits, we could at least get more people some insurance that they need. But right now, for example, I use seniors as an example. $17,000 a year is nothing. So if you happen to have just a tiny pension, like you work for the city or something like that, you have a tiny pension, not anything to really tell home about, just tiny. You won't qualify for Medi-Cal, but you're going to really need it. Maybe you do need caregiver support. Maybe you do need something that Medi-Cal will cover. Dental, for example, Medi-Cal covers dental. And so that is what, and also Medi-Cal covers long-term nursing, where Medicare cuts off at 100 days, Medi-Cal will pick up if you need long-term, like that kind of caregiving nursing type level. But if you don't qualify, guess what? You're private pay. And so many of our seniors are falling through that small gray area of a gap where they're not quite poor enough to qualify for Medicare or Medi-Cal, but they're too poor to pay privately $600-700 a day to a nursing facility to take care of them. And so are their families. I couldn't afford to do that for my mom. I would be stuck having to figure out how to take care of her at home. So that's one thing I just wanted to emphasize with Medi-Cal, and I'm going to kind of come back to why I'm bringing that up here in a minute. So this is just kind of another breakdown of what Medi-Cal covers. So you see it covers a lot of services here, inpatient, outpatient, a lot of preventative stuff for pregnancies, rural health services. I like rural health services. So our people that live in the IE, Kern County, stuff like that, that don't have a lot of access to jobs, they're covered under just rural health services too. A lot of family planning, transportation. Oh, this is a big one. Transportation and medical care. Medicare doesn't really have many transportation benefits. Part C does. That's another incentivized thing the plans came up with to try to get you to come to their plan. They'll pay for some transportation to like doctor's appointments and stuff like that. Dealing with low income, South LA, a lot, that's a really good service, but it's limited. Usually it's limited to a number of trips. Like they'll be like, oh yeah, we cover transportation, but 31-way trips. Well, that means you have 15 doctor's visits that you can utilize for basically the lifetime of your benefit. Typically that one won't regenerate at the end of the year, So Medi-Cal does offer it, but it's almost hell on earth to get it. It's very difficult to arrange transportation. Like you have to call an 800 number 48 hours in advance. The companies that they contract with aren't very reliable. You may be stuck sitting at the office for 6 hours waiting for your transport to come pick you back up. There's just problems here and nobody really doing quality checks in that field, but I just wanted to bring that up. It is covered, so it is useful if you really do need it. Medi-Cal here in California also covers mental health and dental. Which is great, especially the dental part. And so the reason why I talked a little bit about Medi-Cal is because what I envision as the kind of my perfect system is both. It's called Medi-Medi. So if you happen to fall into the area where you qualify for Medicare and your income qualifies you for Medi-Cal, you get what we call Medi-Medi, and you get the best of both worlds. It's kind of like putting the full house over your head. So what Medicare doesn't cover, Medi-Cal does. So you're almost 100% covered, almost. Still having to meet criteria. There's still some gaps there. But when it comes to overall coverage, to me, that's one of the best situations you can have. And the most affordable, outside of the PPO world. The PPO world will rip you a new one, but that's the most affordable, is to have Medicare, Medi-Cal. These both are already funded by us. We pay for it. So let's just expand it. You know what I mean?